Hello nurses, how are you all? Welcome to my channel Nurse Navigator Swati. I am back with the third part of RRB Nursing Superintendent Solved exam paper. Quickly go through my part 1 and 2, review your knowledge and do subscribe for more such MCQs. Let's get started. Question number 1. The strength of relationships among research variables and calculating sample size for quantitative study is based on. Options are power analysis, attrition problems, homogeneity of the population and subgroup analysis. For quantitative study, the correct answer is option 1, power analysis. Question number 2. The system of differentiations which include a hierarchy of social positions are termed as. Options: social caste, social stratification, social mobility or social class. The correct answer is option 2, social stratification. Next question. Following is the management of severe hemolytic disease of the newborn due to RH incompatibility except. Options are exchange transfusion, phototherapy, IV immunoglobulins or antibiotic. The correct answer is option 4, antibiotics. Other option 1, 2 and 3 both are associated with the treatment of RH incompatibility. Question number 4. Which factor increases heart rates of firing during exercise? Options are autonomic nervous system, baroreceptors, proprioceptors or option 4, chemoreceptors. The correct answer is autonomic nervous system, which increases heart rates of firing during exercise. Question number 5. From a physiological perspective, which of the following marks the beginning of the puerperium period? Options are the onset of labor, the delivery of the placenta, the rupture of the membrane or option 4, the first breastfeeding session. Yes, the correct answer is the delivery of the placenta, which marks the beginning of the puerperium period. Question number 6. Dash is an endogamous group associated with traditional occupations. Options are class, estate, slavery or caste. The correct answer is option 4, caste. Next question. Which is an example of reversible morphological change? Options are atrophy, cellular swelling, fibrosis or option 4, necrosis. Yes, the correct answer is option 2, cellular swelling, which is a reversible morphological change. Other option 1, 3 and 4 all are irreversible morphological changes. Next question. In which among the following wound healing process the synthesis of collagen occur? Options are granulation phase, hemostasis phase, inflammatory phase or option 4, maturation phase. The correct answer is option 1, granulation phase, where the synthesis of collagen occur. Question number 9. In third stage of labor, patient experiences intermittent discomfort in the lower abdomen during expulsion of placenta. It is due to. Options are distension of bladder, uterine contraction, dilation of vagina or option 4, episiotomy. Yes, absolutely right. Uterine contraction, option 2 is the right answer. Question number 10. The district mental health program team typically includes all of the following except. Options are a psychiatric social worker, a clinical psychologist, a psychiatrist or a neurosurgeon. Correct answer is option 4, a neurosurgeon, who is not included in the district mental health program team. Next question. The National Mental Health Program was launched in which year with a goal to ensure availability of mental health care services for all? Options are 1982, 1962, 1972 or option 4, 1992. The correct answer is option 1, 1982. Question number 12. Lymph nodes found in the chest near the lungs and heart are called as. Options are popliteal lymph nodes, inguinal lymph nodes, mediastinal lymph nodes or cervical lymph nodes. Yes, you are absolutely right. The correct answer is option 3, mediastinal lymph nodes, which is found in the chest near the lungs and heart. Question number 13. If a patient or relative decide to leave the hospital against advice of the doctor, he or she has to sign which form before discharge? Options are MLC form, NMLC form, abscond form or the option 4, LAMA form. The correct answer is option 4, LAMA form need to be signed. Question number 14. In which of the following grade does a tumor possess cells that are moderately differentiated? Options are grade 4, grade 2, grade 3 or option 4, grade 1. The correct answer is option 2, grade 2, where a tumor possess cells that are moderately differentiated. Question number 15. The parathyroid glands are partially embedded in which surface of the lateral lobes of the thyroid? Options are upper, posterior, anterior or lower. The correct answer, parathyroid gland is situated posteriorly. Question number 16. In a scenario where multiple trauma patients arrive simultaneously along with orthopedic injuries, the ethical principle that guides resource allocation is autonomy, fidelity, justice, or option 4 beneficence. The correct answer is option 3 justice. It is the ethical principle that guides resource allocation. Question number 17. Which laboratory finding is most consistent with acute DIC? Options are elevated platelet count, elevated fibrinogen level, prolonged PT or PTT with thrombocytopenia, or option 4 decreased fibrin degradation products. The correct answer is option 3. Prolonged PT or PTT with thrombocytopenia is most consistent with acute DIC. Next question. In Indian context, UHID in hospital commonly refers to. Options are Union Health Identification, User Health Identification, Uniform Health Identification, or option 4 Unique Health Identification. Yes, absolutely right. Option 4 Unique Health Identification, that denotes UHID in Indian context. Next question. The average increase in the head circumference of an infant from birth to 3 months is. Options are 1 cm per month, 1.5 cm per month, 0.5 cm per month, or option 4 2 cm per month. The correct answer is option 4 2 cm per month from birth to 3 months. Question number 20. Food rich in carbohydrates and fats are called as protective, energy yielding, body building, or regulatory. The correct answer, food rich in carbohydrates and fats are called energy yielding. Option 2. Next question. Which of the following is not an indication for genetic counseling in a pregnant woman? Options are advanced maternal age, option 2 consanguinity, option 3 a family history of known genetic condition, or option 4 routine pregnancy checkup without any concern. Yes, the right answer is option 4 routine pregnancy checkup without any concern. No need of doing genetic counseling for that pregnant woman. Next question. The Association of Nursing Superintendent is currently known as. Options are Indian Society of Nurses, Asian Catholic Nurses Association, Indian Association of Nurses, or Trained Nurses Association of India. Yes, the correct answer is option 4 Trained Nurses Association of India. Question number 23. A key performance indicator specific to orthopedic nursing that should be monitored regularly is. Options are overall hospital mortality, patient gender distribution, number of laboratory test order, or option 4 functional improvement from admission to discharge. The right answer is option 4 functional improvement from admission to discharge. That should be monitored regularly in a orthopedic nursing. Question number 24. Which of the following is a warning sign of mental illness? Options. Number 1 accept self and others, option 2 desires or demands immediate gratification, option 3 uses sound judgment to make decisions, or option 4 inability to cope with problems and daily activities. Yes, the correct answer is option 4 inability to cope with problems and daily activities is a warning sign of mental illness. Today's last question, question number 25. The pH range that supports optimal growth for most bacteria is. Option 1 7.2 to 7.6, option 2 3.2 to 6.2, option 3 4.2 to 5.2, or option 4 2.5 to 3.5. The correct answer is option 1 7.2 to 7.6 is the optimal growth for most of the bacteria. Let me know how much you have scored from this video, and also mention me in the comment the topic on which you want more MCQs and explanation. See you soon in my next nursing quiz session.